Hi, I'm Matt Longjohn, the state representative for the 40th House District, representing Portage, Oshtemo, and Texas Townships. And it's been an incredible privilege to represent my community in the first term that I've had in the State House. And I'm running for re-election in 2026 for the same reason that I ran for office in 2024, to improve the health and quality of life of all of my neighbors, everyone across the state of Michigan. I'm the only physician in the legislature, whether the House or the Senate. And I work on making healthcare more affordable, more accessible, stabilizing the healthcare workforce, and making sure the healthcare system works for patients. Oh, it's such a struggle. You know, it's so hard for even folks in the legislature to keep up with everything that's coming at us. And so for my neighbors in Portage or other places, Oshtemo, you know, where there are issues around single hauler trash or a battery energy storage system or an assessment to raise money for the fire services in Texas Township, you know, we've got a lot on our plate as a community, and it can be very hard to keep up. As a legislator, I'm in a different kind of bucket than a mayor or a city manager. I don't have a lot of resources at my disposal to help bridge that gap for citizens, except for the tools that I have, which is a constituent office. We answer every email, every phone call. My team and I are very proud that since the day I took office in January 2025, we've had monthly coffee hours, happy hours, town hall meetings to go into depth on particular topics when they were in front of the legislature and before the votes were on the floor, so that we could hear from constituents about things like minimum wages or tipped wages or housing policy. But in the legislature, I'm one of 110 members, and it's impossible to know sometimes where those decisions will go. And also, as part of the minority in my first term, people are making decisions without me knowing. So I'm often conveying things just like citizens are hearing, sometimes after the fact, and doing everything I can to make that not be the case, but it is a constant challenge. You know, this is one part of Lansing that has actually worked maybe better than I expected in the last year and a half in my first term in the House. There's been a bipartisan effort, and I'm proud to have voted 3 times for a new way to track how legislators are trying to get dollars into the budget to come back to our communities. We now have a process. It's only the second time that we've tried it in the legislature, the first time being 2025, and now in 2026, where every time a legislator is attempting to get something in the budget, they have to post it on a website, you have to give testimony in a hearing, and I fully believe, it doesn't matter to me that that was a Republican-led policy initiative. As I said, I was proud to vote for it 3 times, because I know that sunshine and transparency is what we need for our government to work best. I thought that was a great idea. It also helps put the quality of projects front and center. And I'm proud that in the 40th House District, as I said before, as a minority member in the House and a first termer, I'm proud that I was able to bring more money home to the 40th House District than any other Democrat in the legislature in 2025. I think because of the validity of the ideas and the importance of transparency. Well, I'm going to refer back to one of the questions I already answered. I believe that our government works best when those who represent us do so, that they show up, that they make themselves available to their constituents, that they are responsive, that they take the time to understand what the issues are in the community, and make themselves available every way possible to answer questions, to inform their policy statements, you name it. So again, since January of 2025, the day I took office as my first term in the House, My team and I have made sure that across Portage, Oshtemo, and Texas Township that we have, on a quarterly basis, open, public, almost town hall style events at different times of the day, different days of the week, to try and make it work for the citizens of the 40th House District so that they know they can access our office and get the answers they need. We do 2-hour-long coffee hours at the Portage Senior Center or at Oshtemo Township Hall or at the fire station in Texas Township. Every month, it rotates between those 3 locations. And then for working families who have questions but who can't take time off in the middle of the workday, we do these happy hour events. And I won't name the commercial establishments where we have these events, but they're happy hours. And those rotate as well through Portage, Texas Township, and Oshtemo Township. And in addition, as I mentioned earlier, when we have had really important topics like what should the minimum wage be? How do we deal with removing taxes on tips for tipped wage employees? Or how do we make sure that everyone has paid sick leave so that they can take care of themselves and their families? When we had that town hall meeting, we had over 100 people show up at a town hall meeting in Oshtemo. Last summer, when we were in the throes of a budget battle and schools were worried about losing enough money to keep the school meals program happening, I had a town hall with leaders from KRESA and Kalamazoo and Portage Public Schools and brought citizens together to really understand what was happening for their families. And I'm very proud that we have a 100% response rate to emails and phone calls in my office. Working for you is my job and my priority. I was able to convey this in my first video, 2024, talked about how the fact that I'm the only physician in the House or the Senate and the legislature, but that I know that you can't live your healthiest possible life if you don't have a roof over your head or you don't know where your next meal is coming from. So I've been working on housing with that perspective, with urgency. What we've done in Kalamazoo County is laudable. I was trying to think of the word. We've passed millages. We've got a county commission that has worked on establishing new transitional housing options for folks who are housing insecure. We've done a really good job as our community of getting started in the work that we're going to need to do to address housing. But housing starts have been declining for almost 2 decades now, and we've got a lot of ground to make up, and the cost of housing has not gone down. It's harder and harder for folks who have long-term care needs, for example, or for our youth in our community to be able to afford housing. So in full transparency, I've been getting myself into a little trouble around housing. I have been one of the sponsors of a package of bills to take on zoning reform, because we need another tool in our toolbox to increase housing options like mother-in-law units above garages, or otherwise known as accessory dwelling units, or duplexes on what was perhaps previously single-family home parcels. As we continue to do infill and housing development in our communities, we're going to need more flexibility with zoning. Not all of my friends in city and county government like what I've proposed, but I believe that we can't wait for the perfect solution. We have to act on what is possible now. I know that that helps also protect farmlands, prevent against sprawl, which can increase the need for sewer or water hookups and other things that increase the cost for taxpayers across the community. So I'm proud to be one of those folks fighting for urgent solutions to housing. We have a lot of work to do. Yeah, this is such a difficult time to get into conversations about public safety, because there are local issues, there are state issues, and then there are, of course, federal issues. And what we've seen in the last year and a half from the federal government, specifically with the way that ICE has been funded, trained or not trained, and deployed, has led to a lot of concern about personal safety, not just public safety. I'm proud to be a co-sponsor of legislation in the House to restrict ICE's activities around sensitive areas, churches, funerals, court hearings where maybe you're going to get your documentation that you need to stay in the country. At the federal level, it's been a mess, and at the state level, there are many of us who have been trying to put up guardrails and make sure that when ICE is trying to do its job, it's doing so within the bounds of the Constitution. Participating in town hall meetings and doing webinars with communities that are most affected to make sure they know their rights are among the things that I've been working on in the first year and a half in the legislature. But the broader question about public safety has to also include topics like gun violence prevention. I'm proud to have sponsored legislation to deal with that too. I've spent 25 years working on gun violence prevention in the healthcare sector and have brought that priority with me into Lansing. So in the budget fights that we're having, I'm fighting for things like community violence intervention grants to public safety departments, county and municipal public safety offices, to get them the resources they need to practice restorative justice, to practice the prevention of violence. As a preventionist, I'll always continue to work on those things. Affordability, affordability, affordability. It's not just the topic du jour, but it is the lived experience of so many of our friends and family and neighbors. It's too damn hard to make ends meet these days. We have this K-shaped economy where if you are in the top 1% and have a big stock portfolio, you're doing okay. But the rest of folks in the community who aren't so privileged are really struggling. I've already answered a question about housing. Increasing density and innovating to create more options is one of the things that's important. But one of the biggest drivers of affordability is healthcare. The moment I arrived in Lansing as the only physician in the legislature, I started working on things like reducing the cost of prescription drug prices. I started trying to put together a package around increasing primary care access, because not only is it too expensive, healthcare, it's also too damn hard to access. We need to bring more doctors to our state. We need to change the way that our medical teams work to bring lower cost preventive services to the community. But other things that I've done, I was proud to be on the select committee that ended up putting together the package on increasing the minimum wage in our state. We've been falling way behind for decades in the minimum wage, and now with some of the policies I helped to push through this past year and a half, we are going to be at $15 an hour. Still not a completely livable wage, but we're making progress. Taking taxes off of tips and overtime is part of what I've worked on. Other things that are important to me include the cost of childcare. I support the ballot initiative. Personally, I support the ballot initiative here in the county, the millage for early childhood education. And as the minority vice chair of higher education, I've been helping to fund with record amounts of dollars our K through 12 education and our higher education and community colleges. So making sure that through the Reconnect program, anyone can access at age 21 and above is the goal, for anyone to be able to access community college for free. We need to make everyone's lives a little easier by making many things less expensive and more affordable and accessible. I'll be honest in that I hope that what the role has been for state legislators in the last year and a half can change in November. But in the first year and a half that I've been in the legislature, in many ways, my role has been playing defense against what's been happening at the federal level. Hundreds of millions of dollars, billions of dollars coming to Michigan and Michiganders was cut by DOJ without any kind of rationale early on. That led to people not sure whether they were going to be able to keep their health benefits, whether their Head Start for childcare for their kids, or their schools, or other human services were going to be there when they needed them. So, in my role at the state level, it's speaking up and fighting back against those things. I'm not the Attorney General, and Attorney General Dana Nessel has done a whiz-bang of a job to fight back with the tools that she has. But in the legislature, our tools are to create policy that slows down those changes when they're maybe violating our constitutional rights. As many court cases have shown, what the federal government was doing in early 2025 was unconstitutional, and those dollars have come back to Michigan. In the roles that I play in the legislature this term, I've been on the Appropriations Committee for Human Services. So that oversees, for example, the SNAP budget, which is the Supplemental Nutrition Program, or what was previously known as food stamps. When the government was shutting down in September and October of last year, my caucus turned to me and asked to keep them all informed and how to create statewide efforts to push back and to advance the budget that we needed to make sure that 1.4 million Michiganders who depend on food assistance, but who had different dates that they got their EBT cards loaded, knew that they wouldn't run out of food at the end of the month. Those are things that I've been proud to work on, and those are things that contributed to being named to being nominated as a Freshman Lawmaker of the Year in Lansing. Last but not least, but perhaps most important to me, I've been a part of bipartisan solutions to keep every Medicaid dollar we could into the budget in 2026. We didn't lose a single dollar when we put money into roads or put money into schools. We didn't lose a single dollar in the state budget for Medicaid. And that's important because it's not just people on Medicaid who might lose their insurance because of H.R. 1 at the federal level. We're expecting up to almost 300,000 Michiganders to lose their insurance because of H.R. 1. But when young, healthy people are pulled out of the Medicaid pool, it increases the risks for all of us. So I will continue to work to support our healthcare system being more accessible and affordable to all, people having access to the food and housing they need, because again, you can't live your healthiest possible life without those things. This is our nation's story. For 250 years coming up this July 4th, we have often, maybe consistently, persistently, had structures and systems that minimize the voices of people of color. Before I came to the legislature, I worked at the local medical school where a course that is a required course for the first and second year med students was all about health equity, making sure that folks who, again, need food assistance or housing assistance, folks who have been systematically suppressed, had a voice in healthcare. Recognizing the science that, for example, black women of color black women in Kalamazoo who are moms have maternal and infant mortality rates that are too high. We have to make sure that our systems that are constantly devaluing and removing the voices of people of color are addressed systematically. We cannot remove things like implicit bias training from our healthcare system. We have to train our next generation of health professionals, as an example, for how the system has continued to make it harder for people of color to live their healthiest possible lives. The same is true in other sectors of our society. I'm just focusing on healthcare because that's what I know best. But when we don't lift up these barriers, when we don't recognize redlining on housing or the lack of pain medication given to people of color who are reporting pain in emergency departments, we are complicit in silencing those voices and keeping people suppressed. So I bring what has been a part of my career for 25 years with me to the legislature and work with others to lift up those voices. I'm proud to often take a back seat to members of my caucus who are people of color, who have lived experiences that I don't have, and just be part of their team, to be allies with them in this fight. As a person not of color and of privilege, I know that that is one of the biggest things that I can do. It's something that is keeping me up at night. We have clearly unconstitutional actions being taken regularly by a president that has very little oversight by either of the other two branches of our federal government. And the way he leads is he pushes the boundaries. He goes past what we all would recognize as the norms and cultures and laws of our country and says, prove it that it's unconstitutional. And then when it is found to be unconstitutional, he says, okay, well, I'm going to find another way around it. I believe that when public officials take their oath to the Constitution, that those are not the practices that we need in our leaders. On the other hand, as much as the stuff that's happening at the federal level keeps me up at night, what I'm seeing in our communities is encouraging to me on a daily basis. The number of people who are writing to me, emailing, responding in social media, showing up at No Kings rallies, showing up at township halls to discuss things like battery energy storage systems in Ashtamo or the single hauler issue in Portage is encouraging to me. Democracy can be messy, but we all have to participate for it to work. And that includes Republican members of Congress, and that includes you. Show up. The world is run by those who show up. That's the way through this. I am both concerned and optimistic about what happens next in our country. So many things, but let me touch on a topic that I haven't brought up yet, and that is money in politics. I am one of those folks who does not take any corporate contributions into campaigns. I don't believe all corporations are bad. I don't believe that capitalism is fundamentally bad, but I think that an unregulated capitalist system where the voice of $1 from a corporation might mean more than the voice of a citizen at the ballot box is a fundamental problem for our democracy. When I ran for the U.S. House in 2018, I took a pledge to end Citizens United, which would require a federal constitutional amendment. And until we have something like that, our hands are tied a little bit at the state level. But I do support, again, a ballot initiative to take money out of politics here in the state. I don't take those corporate dollars myself because I think that that is important, that voters know that it's their voices that are heard by people like me. And that's just one thing that I think is worth our conversation here about what is important for civic engagement in our democracy at the 250th anniversary. But again, I think that it's about showing up, and we need to make sure that our youngest kids, I just had 5 student groups come through from Amberley to visit me at the Capitol last week, that they are learning about government, that they are learning about the power of their voices, that middle schoolers and high schoolers and young people who are struggling with housing and affordability know that they can themselves get involved or participate by joining campaigns like mine, or just even engaging in the work of the legislature by contacting my office, telling me what you're interested in. Again, my office has a 100% response rate to things like that. Again, the world is run by those who show up. We've got to get our youth ready to do that. Again, it's an incredible privilege to represent the 40th House District in Lansing. I'm deeply honored by that privilege that voters gave me in 2024. And when I was deciding to run again in 2026, there were a couple things that were top of mind. Number one is, of course, the health and quality of life of all Michiganders. As the only doctor in the legislature, I feel like I have 10 million patients. And when I look at the impacts of H.R. 1, the one big mess or beautiful bill, depending on how you want to describe it, and the projections that 200 Michiganders might lose their health insurance, I decided to run for re-election in 2026 because I know that my voice is needed in Lansing. I've demonstrated in the first year and a half as a public servant that I can bring that focus on health and quality of life to the legislature, that I can be effective in creating bipartisan solutions to things like our Medicaid budget, and I think that I can contribute to the challenges, to solving the challenges that we will be facing in the next 2 years. I hope to earn your support and your vote in this elections season in August and in November, and it would be a privilege to continue my service to my community.